just to transition into this panel, because as the question was asked about the government shutdown, here's a news flash. We're facing another government shutdown in 2 weeks from tomorrow. So this is real, and the organizations that are represented here, and some of your organizations that are on the call, what do they call that thing? It's Groundhog Day. Here we are again. So, but this panel, talk about partners in good. This panel, my rides or dies. And as we were putting the conference together, and the discussion was, what should we talk about? And part of it is what we're going to talk about and where we find ourselves as BIPOC leaders facing some significant challenges, and I know sometimes our magic wand is like the battery gets dead, because we use, you know what I mean, Linda? We use it every day, every night, so it's just a pleasure for me to, oh, you have a magic Thor? No, we gonna find another game, another name, not Thor. We got, like Shaka Zulu or something like that. We got to find something African to call you. Um, but it gives me distinct pleasure to not introduce these folks to you, but we're gonna share, we're gonna have a conversation like we're sitting down at lunch, that like we do ever so often. So I'm gonna ask each of you to maybe just use 30 seconds to let the folks know who you are, because there may be some who are seeing you for the first time. So let me start with you, Angie, who you are, your organization, and how long you've been in the role.
Well, thank you, Jerome. I'm so excited to be here with all of my friends for this important discussion. So, my name is Angelica Perez Delgado, and I get the great pleasure of leading Ibero-American Action League. We are the largest leading dual multi-service language agency in upstate New York, running from Albany all the way to Niagara Falls. And I've been on this role, it's going to be 6 years, February 9th. Time flies.
Um, so you just COVID just came like bam, right
Yeah.
there. Linda Clark, my sister.
Morning. Linda Clark. I'm a physician. My specialty is one that nobody seems to understand, including my fellow physicians. I'm trained in preventive medicine and public health. Specialize in that and occupational medicine, which is work-related medicine. So I usually, in this role, I get to use my public health hat and prevention hat most of all. I am the current president and CEO of Anthony L. Jordan Health Corporation. Anthony Jordan, as most of us know it. I wrote in the chat, but they were asking like, why? How did you get into this? I've been in and out of Jordan for quite a while, and I did come back as the chief medical officer because the last one wanted to retire and they couldn't find anybody. So I was at Common Ground Health and I came back and then became the CEO very shortly after. My predecessor, I fell for the okie dokie and ended up, after just as a year of the CMO, being the CEO and the CMO at the same time for a while. So I've now just finished 2 years as the CEO, but only 1 year as being just the CEO. So just getting started, which is exciting.
Yeah, we know you got the magic wand. We know you do.
Not my Thor, and I don't remember the girl Thor hammer, but that's what I got. That's what my finance team gave me when I got out here. So.
Nikisha Ridgway, good morning.
Good morning. Thank you for having me. Nikisha Ridgway, President and CEO of Starbridge. We are a disability organization and through the OPWDD, Office of People with Developmental Disabilities, sector. I have served in this sector for 30 years, and I returned to Starbridge 6 years ago, and I have been in my current role as president and CEO for about 3 years.
Thank you. Thank you. Dr. Chanel Harkins.
Thank you. First of all, thank you for having us. I'm just excited about this conversation. I am Charnel Hawkins, and I have the honor of serving as the president and CEO of the Urban League of Rochester. And proud to say we've been around since 1965. This is our 61st year. And we celebrated our 60th year like ABC. And we are a civil rights and advocacy organization, and our mission is to prioritize African Americans, Latinx communities, any community that has been disadvantaged, marginalized, and create access to power, parity, and civil rights. And I have another job too, my side job, that I don't get paid for, but I want to mention it because it's really important. I chair the New York State Community Commission on Reparation Remedies. And that is important work that New York State is exploring reparations. And when we did the land acknowledgement this morning, I'm learning how important it is to do a labor acknowledgement at the same time, right alongside of it, to acknowledge the Black labor that was benefited from to build not just this country, but New York State as well. And so I'm learning from New Yorkers the history, the untold story, and this process of truth telling is important. So I'm happily engaged in that. So thank you for having me join and share that as well.
And thank you, all of you. And Dr. Clark, my first question is going to come to you. I shouldn't say first question, the next question. But I'm gratified because multitasking here, and we know you had double duty today. But your other event has been postponed, so you can stay for the duration. Some of you may know that our other partners in good, Rochester Regional Health is going to have an MLK Day event starting at around noon today. But that has been postponed due to the inclement weather. So, Dr. Clark, you can just relax and chill with us for the duration. So my question is to you, Dr. Clark. And first, a bunch of these questions, we're going to get personal a little bit because as BIPOC leaders, again, that when I mention a magic wand, it's not too far from the truth. So, Dr. Clark, how do you manage self-preservation while growing these multiple amount of partnerships that we talk about? How do you preserve yourself?
Okay, and I know I have, I think, 3 to 4 minutes, and I'm happy to share my minutes with my colleagues here because I feel like the question's on two level. I'm out of focus. One is on a personal level. How do you keep, first of all, what is yours, your intellectual property, your heart? How do you preserve that in the atmosphere that we're in right now, but also reaching out to other people? And I have to say that you have to have that circle of trust, I think, to be able to do that. I feel like there's some days I've gone home and not been able to talk to anybody about the day that I've had for fear that other people will use that against you personally and against you organizationally, which seems so harsh, but true. So organizationally, it's also an issue. How do I preserve from Jordan patients, for Jordan employees, for this community, what is important while exploring partnerships? Because I think oftentimes everybody says, oh, well, your community health centers need to work together. Yes, we do. We do need to work together, but let's be clear, Jordan is the legacy here. We are part of the movement. You talk about the civil rights movement. We're here because of ABC. We're here because of Baden Street. We're here because the people asked us to be here. So that legacy is something that we have to preserve. We have to. And we can make believe that other people can do what Jordan does, but only Jordan does it the way Jordan does it. So it is very important that we have partnerships with organizations that get that and understand it. So how do we figure out what's the right partner for us? We look at data, right? We try to understand, well, what does the community need? Where are they falling short, health wise, and what do we have that we can offer? What do we do well? What don't we do well? What can we partner with somebody on for those things that we don't do well, so that our community gets what is needed? So there's a bunch of assessments that need to occur. Not only how many people have diabetes, but how many people can get diabetic education in Spanish? How many, there's other levels of assessments that are needed. And then I encourage, my staff, how do we take advantage of what our partners can do, and how can they take advantage of what we do, so that the ultimate mission is carried out for our community. So, and then sometimes it's making hard decisions. Not everybody who's with you should be with you. They say, people, are you on the right bus? Are you in the right seat in the bus? Some people don't even know what lane, where to pick up the bus, where the bus stop is. So it's hard to make some of those decisions. And from the outside, it may look, like, oh, wow, you're being calculating and cruel. No, just keeping the mission in mind, and being a steward of the resources that are entrusted to us, to make sure that we're doing the right things for our community. So I think I'm out of time, but I would love to hear what other people have to say about that as well.
The time is it's just a guide,
It's just
you
a
know.
guide. It's like a funeral, right? 2 minutes. Okay.
Oh, oh gosh, how about the wedding? How about
Okay,
wedding?
a wedding.
How about a wedding? How about wedding? No, we'll just use it as a guide, because, like I said, we're just here having lunch.
Okay.
Um, Angie,
Yes.
what are some of the most significant challenges you face as a CEO right now, both operationally and personally? What are
Yeah.
you facing?
I also, this is going to touch on what you were talking about, Dr. Clark. I was welcomed by a pandemic. I was welcomed by $1 million OMEG audit fine,
Mm.
that had just occurred right before I came on board. And my time at Ibero has not been easy. And Dr. Clark, I recall coming home and crying tears, thinking, how do I move through this, right? How do I take this very important legacy institution that has done such amazing work for our community and is responsible for all the many great things we call Latino and the advancement of our community here. And one of the things that I learned in the beginning is that I needed to have courage to ask for help, courage to talk to other people. I found out very early in my tenure that I wasn't the only one that was facing these challenges. So allowing that space, right, for other people to feel safe to talk about those things with me, and for me to have this network that I can now talk about in a very private way what my institution was facing. The greatest challenges that I face is I had to divest. I had to divest $3.5 million worth of legacy programming that I felt was dragging our institution. Um, as a woman leader of color, I also experienced what it felt to be micromanaged, to be told how to turn around my own institution when I felt and believed that I had a very clear vision about how my agency was going to move forward. So I had to really learn, and Simeon touched on this, that I had to lead with a great heart, with a big heart, with a courageous heart, but also with some operational rigor that not everybody was giving us credit for. And I had to learn to bring people along into the operational rigor. And that's why I believe that institutions like ours need to claim that legacy just in the same way that Dr. Clark just did, because we don't get to be around for 65, 68 years, experience all the things that we experience and not be operationally rigor. I challenge anybody who thinks they can do these jobs to come and do it for the pay, to come and do it for the hours, and still pull forward some of the outcomes that we pull forward. So for me, I was writing down is really about being courageous, having to divest, having to turn around. And on top of that, I still had to show up for my community without missing a beat during a global pandemic, no matter how much Iberia was bleeding, during a migrant crisis, and today during this administration and the things and the injustice that we're experiencing. My institution doesn't get the luxury to be like, oh, I'm going to tap out, because I need to work on some things internally. We have 32,000 lives that count on us every single day. I have 180 employees that live and breathe this mission and live in these communities. And so that's, I think, to me, my greatest challenge is communicating that to everybody that funds us, to people who say they want to partner, but then they want to tell us how to partner,
Mm.
or what's appropriate and not appropriate, and to really uplift the work that my staff does every day with the value and the worthiness that they deserve, because I still challenge somebody else to come do it. If somebody has a solution, like, we're here. I want to work myself out of a job. I want an agency like mine not to exist. But unfortunately, our reality in our communities are very different, and it's hard to constantly have to sell yourself after delivering for 65 years. So that's, I think, to me, my greatest challenge.
Excellent. And and in between questions, if you will, I just want to give a huge shout out to the staff at Jordan, at Ibero, at Starbridge, and at the Urban League of Rochester, and Action for a Better Community, and all the other human service organization people. Let's just big them up for a minute because, again, Angie just said it. I mean, nobody is working in our organization is going to retire rich. You know, the mission that we work on behalf of others. Nobody comes here saying, today's a good day. Everything is wonderful. No, people come to us in various levels of 10. It's 10 plus. So, and our staffs have to find a way to, while they're dealing with their own stuff, because our staff, because what I know a lot about Jordan, I know a lot about Ibero, we are the community. We are the community. We are the people that we serve. So, Dr. Hawkins, we coming to you next. Leaders of color, BIPOC leaders, often carry both the responsibility, and Angie just said it, of running a complex organization while also having the unspoken expectation of being anchors in our communities. I mean, somebody push a mic in front of you like that, and you have to be the spokesperson. In moments sometimes when need is endless, and Angie said resources are not. The needs are endless, the resources are not. How do you fortify yourself, Sean, and keep leading with clarity without that burnout? How do you do that?
This question is real. Angie, you spoke to it. I want to say that we inherited, sometimes you inherit organizations that are under-resourced. And when we talk about broken systems, and I'm going to get to the question, but I just need to just give you a little bit of the why. When we talk about broken systems, when you are and I'm going to call it social service organization or social enterprise organization, Simeon, I'm not going to call us a nonprofit anymore, but our funders sometimes, and I'm going to talk about state funders, federal funders, they operate alongside of us with a deficit, really not even as an asset to the community, right? We are reimbursed for the work that we do. And we're not reimbursed. I can't imagine going someplace and eating and now say, I'm going to pay you 90 days later, maybe even 180 days later, and might call you and say, I'm sorry, we're running behind, we're understaffed, and you might not get paid for a couple of months. And don't let it be a government shutdown. And you still have to operate the organization. You still have to show up with your team with a smile, wondering about payroll, right? And when you're under resourced, so the system is broken. And so you have to be a bold leader. And the only way that I can show up and be a bold leader is have a network of people that I could call that I feel like are similar bold leaders, and that's Angelica, Jerome, Dr. Clark, Nikisha Ridgway, Simeon Bannister. Because when I think about even Bill Johnson, he was a bold leader, right? And he had to think about how he could help the organization, the Urban League, survive. But I'm hoping to build on that and just not survive. Now I've got to take what I'm learning and say it can't be this way. It needs to be a revolution. I'm thinking about Kirk Franklin, right? There has to be a revolution. We cannot continue to operate this way, being under resourced, paid late, having to prove the work that we've done. We haven't we proven ourselves in the last 60 years? We provide operational rigor within our organization, and still we're having to prove ourselves. So how do I fortify myself? One, I'm learning. It's taken me a while. I've been with the organization 6.5 years, but I begin every January with just a reset. I step away for 2 weeks and just think about what it is that we're going to do. We begin the year with prayer. We reset. We have to fortify ourselves in spirituality and strength. And the church has been the DNA of the Urban League. So we begin our work with prayer. But you all have been a resource, right? I remember when I started, Angie and I had a very similar start, going through those OMEG audits and understanding that our organizations were positioned to have to pay the state millions of dollars. And I remember her telling me, call this attorney, do this. And she was someone that I could reach out to for help and then put a strategy in place. So having a network, a tribe that you can go to, a trusted leaders. And I'm grateful for this circle that we can be that. But also, there are many community leaders that need that. So I would say making sure that you have that core group that you can reach out to share what's happening in your organization, strategize with, and make sure you make time to reset, because burnout is real. It's real because you have to have emotionally you have that emotional labor of doing this work and having to show up, and someone puts a microphone, hey, this happened today, can you and you're dealing with a crisis in your organization, and you have to say the exact thing that you don't the right thing, because someone else is going to quote, why did you say that, why did you do this, why are you responding this way? A lot of emotional labor that goes into this work, and also be a cultural broker. So I'm grateful for the opportunity to one reset by taking time for myself, and then having a network of community like you all who are on the call right now, the panel right now, to reach out to and share.
I see. And thank you. Thank you. Thank you. Nikisha,
Yes.
when you think about leading in this time, as a Black woman CEO in this human service space, a couple questions. What has surprised you most, if anything, about this moment in your leadership journey? And where have you found strength? And where have you had to be honest with yourself about these challenges that we're all talking about?
Great question. I just wish it wasn't after Dr. Hawkins. Can you hear me?
Yep, we can hear
Okay.
you. It's a little low, but we
So,
can hear you.
so what surprises me in 2026 is how few of us are actually in the rooms and how isolating it is. Because as I saw other, like my counterparts, as they advanced and grew in their careers, and there's little representation, for Black women in these lead positions, especially in the disability sector. I'm about the only one. There are a few in the C-suite, but I'm about the only one as a CEO. And that, saying it's lonely at the top, I quickly began to realize how it's even lonelier as a Black woman as you reach these levels. And Not that I was expecting pomp and circumstance, but I thought the arrival would be different.
Mm,
And I had to, the strength, my faith, I really had to rely on my faith and the belief in myself. When I returned to Starbridge 6 years ago as the chief operating officer, I began to realize that operationally, the organization was not strong. We immediately entered the pandemic, as you heard with Dr. Hawkins and Angie. And I had to focus on securing operations, improving service delivery. And then the stark reality was I didn't have the access to the rooms and the resources that I needed. And so I was the chief operating officer, so I wasn't the CEO at that time. So it was difficult, again, accessing the rooms, realizing and identifying what rooms I needed to be in. And then I had to begin to focus on strengthening my network and being intentional about building relationships outside of my comfort zone and outside of the OPWDD provider network because I didn't have a community. I had a community of colleagues, but again, their access to the resources because disability is white. And here I am as this Black leader navigating these spaces for 30 years. And when you look at our sector, like 47% of the direct support professionals, which I started as a direct support professional, are people of color, but the trajectory and the advancement, the oppression is real in this
mm,
sector. I should have many colleagues around me when you look at the 47% of people of color who are doing the Black job at that direct support professional level. So I really had to, for my own sanity and to prevent burnout, I had to focus on building those relationships and so that I could have some covering and guidance from people who I didn't have to explain myself to.
mm.
So I'll leave it
Yeah.
there.
A quick follow-up with that, Nikisha. That was a big statement. At least it hit me when you said disability is white.
It is.
Could you elaborate on that a little bit, please?
So disability it intersects with all identities.
Hmm.
But when you look at the scope and even the eligibility requirements to access services through OPWDD are the same, but Black and Brown people are not accessing services at the same rate as their white counterparts, and they still have obstacle and red tape after red tape to get these services. That is part of the reason why I remained diligent and focused for 30 years in this sector because I wanted people who looked like me, and I do have family members with disabilities, and I wanted people to that looked like me to at least have some representation somewhere. I can't be in all places, but I wanted people to and I wanted people to be able to see that there is representation and that there is a degree of safety should I come to your organization. Um, and I would say that is part of the reason why many people of color are accessing services. When you look at the the leadership makeup within the disability sector, there are very few people of color beyond the direct support mid management level.
Well, that sounds like some work we have to do, collectively in supporting you and others like you in that vertical. But again, so the people who are listening now, they know, so and part of this is making it plain, like Malcolm X would say, make it plain. We're making it plain. Angie, we're coming back to you.
Yes.
And all of these questions are somewhat leaning in the same way because, you know, just to let the audience know, once a quarter or so, all of us go sit at lunch and we talk and we lean on each other, cry was necessary, laugh, joke, and this is the kind of stuff we talk about. And we said, well, others need to know, you know, what's going on. If, again, truth is a necessary thing for good health. So, Angie, let's talk about support structures, not just us, but what kind of support structures has been critical to sustaining you as the effective leader you have emerged as?
Yeah, I mean, I think going back to what all of us have been saying is really developing a network of people who understand the role and understand the nuances that occur when you're a BIPOC leader in this community. I always love how Wade puts it, Rochester is always nice, but there's this underground thing that happens under that niceness that I think as leaders of color, we are more sensitive and more attuned to it. That does create this need for a space for us to come together to say, is this happening to us, right? Are you experiencing this, Dr. Clark? Are you experiencing this, Nikisha, for us to be able to work through that? So that's really, really important because the job, a lot of us went up the ranks by being second in command. I was chief admin at the Villa of Hope. This role does look very different than that view. The complexities are very different. The way of the responsibility is very different. For me, it's also mentoring and coaching. I've surrounded myself for a very long time with people who will tell me the truth, who will speak truth and love into me, who I can go and be vulnerable and say, I really don't know, or I'm scared, or I don't know what the next move is, or I don't know how to approach this person and ask for help. I think that's really, really important to have a space where you're vulnerable. I also think my husband, who is like so practical, like my husband does not work in this
Yeah.
sector. And whenever I talk to him, he just makes it so simple. And then I walk away going, you're right. Like that's what I need to do. So sometimes not underestimating our families, thinking that our jobs are too hard and or they don't understand because it's so complex, because sometimes it takes someone that does not is not part of our world to say, hey, what are you doing? I mean, really through some of his pep talks, I found my courage to say, hey, like I took this job because I love and believe in this mission. Like I'm not gonna quit now, right? I'm not gonna let the system hold me down. But also taming my ego. Taming the ego is really at the core of this. And I always say leading Ibero has been the most humbling thing that I have to do. And I remember when we were working through our crisis, driving to Pennsylvania and thinking, this baby gave over for us. And then in that drive, reminding myself that I am within a community that knows Ibero's value. And how unfair would that be if I didn't reach out to those people and say, Ibero is in trouble and we need help, and allow them to help. And I remember writing an email, sending it out, and then 3 days later, 5 o'clock in the afternoon, I was at Simeon's place because Simeon is such an amazing leader. He really is. Like he believes what he says. He's a good human. Sitting at Simeon's place with every foundation CEO, the entire state delegation, their program managers talking about what Ibero needed because we were gonna die. It wasn't a matter of diversifying revenue. It wasn't a matter of any of those things. I was in a battle with Nikisha's main partner, OPWDD. I was battling for the identity of the largest dual language organization who a system kept looking at like just an OPWDD provider. And I'm trying to say, we are not just an OPWDD provider. There will be a gaping hole in this community. And that to me was a defining moment as a leader, because that's when I learned that if I felt alone, it was by choice,
Mm,
that I
mm,
needed to just be courageous and build relationships and ask for help and always be honest and always be clear about what I needed, and that people will always respect that in my leadership no matter if they understood my strategy or the operation. So that I think is to me how I've sustained this work to this day. I played CFO for 2 years, the last year after that horrible transition. And I went to Jerry Archibald and I sat down with him. I sent him my financials and I said, Jerry, we've been through hell and back. Tell me, do I need to quit? Do I need to stop? And when he looked at the financials, he says, Angie, you guys are working this, right? You are working yourself out of this hole. Um, and he came and I said, can you help me? And he did. And he's still helping me and leveraging all his resources. So we just sometimes need to tame our ego,
Yeah.
remind ourselves that this is not about us. These are institutions that are going to outlive all of us. Um, and ask for help. Just ask for help.
Just ask for help. And shout out to Jerry Archibald, who is also a dear friend. And that reaching out, I'm laughing now because, you know, James Norman, let me say his name, he will let you know that he gets a call from me ever so often just to say, could you check my homework? Just check, correct me where I'm wrong, and or, in times of uncertainty, which only come, on days that end in a Y, those times of uncertainty, you know what I mean, Linda? So in just having people to you know, and I think it's safe to say to lean on because sometimes you do need to lean on because it's not easy. But we were made for times just like this. And one of the things that we have been talking about, and I'm coming to you now, Sean, because we're also thinking about the space we occupy. But Angie just said it, we won't occupy these spaces forever. So when you look ahead and think about leaders who are going to come after us, what do you believe, Sean, must fundamentally change about how BIPOC-led organizations are, one, resourced, trusted, and supported so that the next generation of leaders coming after us can really lead with courage and deal with, just the services rather than all the other stuff. Rather, they can just do the work rather than based on, like Angie was saying, just survival. Because imagine if Angie wasn't, and some of us have been dealing with most of last year just hanging on. What do you think has to happen for people coming after us?
I think this question is critical because when we think about ourselves as leaders, we've got to think about ourselves as the intermediary between now and the future. And so we always say we want to leave the organization better than we started, but it reminds us that it's going to take our bold leadership to prepare for that. And so what that means is number one, we have to make sure that our organizations are resourced for possibility and not scarcity. And so this whole system has to change. And so when I listen to Angelica talk about, I'm telling you, we live the same story when we talk about things that our organizations, how we've been under resourced and how we have to untie ourselves so that when we do, because we're here temporarily and preparing for the future, we have to make sure that we're not operating from a place of scarcity. So that means that our organizations, number one, have to be trusted, have to be resourced appropriately. And not this reimbursement system that I sort of alluded to earlier, right? We have to make sure that we're not operating from a place of survival. So it takes long-term investment, stronger boards, funders that see us as necessary and mission critical to the community's need. And if we get this right, the future leaders will spend less time having to prove their worth, and more time advancing the mission. And so it's going to take us to do this work. And Angelica and I are doing some untangling. And I love that you talked about being open. I've been on this road show. And if you're in the housing development market, I've been talking to folks about help me. I'm trying to figure this out. I've got to figure out how to get our organizations in this place where we can operate and it's not bringing us down. And I think, all the folks that are helping me and have a call just reaching out and saying, hey, I need help because I want to make sure that the organization is prepared for the future. So that when the next leader comes in, they can only think about vision. They are resourced abundantly and not from this place of scarcity. And so I think that's important, but we have to look to funders. We have to be bold and say, "No, I'm not doing this on a reimbursement basis." And sometimes that means saying no to a grant, and we've done that. We've done that. And we even got pushback. Why are you saying no? Why are you doing this? Because we can't operate. If you have 30 reimbursement grants, how can you be successful? How can you focus on vision in the future? And so we have to make sure that funders see us for our worth. We can't continue proving ourselves. So I hope that in the future, I'm doing the work now, and Helica's doing the work now, and Dr. Clark and Akeisha, we're doing the work now. So those future leaders, they don't have to worry about this. They can just focus on meeting the community needs, and hopefully the communities won't need us the same way that they need us today. It'll be more so that we're brokering, making sure that we continue to have access, but they won't need us the same way we do today.
Shake from your lips to God's ears.
Yes, it's done. It's
Yeah,
done.
yeah. Dr. Clark, what are some of the tangible examples of how this group, what do we call ourselves? The Racism is a is a public crisis coalition.
Oh, okay.
What are some of the tangible examples of how this group has worked together or planning to work together? Sean just said something just now, you know.
Mhm, mhm. I don't know. We're always thinking of what's coming down the pike, what can we do together? And one of our members who isn't here right now, Sharita Bullock, Healthy Baby Network, is a great example of let's work this thing out. We provide the medical services, but they've got everything else, going into having a healthy pregnancy and a healthy family. So, some real tangible examples are, we are in agreement that they have community health worker, they're going to embed, that's all about maternity care. They have doulas, as we know, they have the Black Doula Collaborative. We've got the patients, right? So we need to work together so that we improve the outcomes in our community around maternal health, which is a whole nother conference. We've worked with Ibero. Ibero trains community health workers. They've trained, we have a community health worker. I think she's been through the program 2, 3 times just because she want to make sure she's not missing anything. So we have that ongoing partnership. In times of COVID, I can speak about, even though I wasn't at Jordan, I was at Common Ground, and we were working with Ibero. We were working with, Jordan at the time. I was just thinking about the fact that, and I think it was Ibero that took the lead on this, that monthly rodeo. Actually, it was like every week for a while. It started off as a rodeo, outside, and then we went inside at St. Michael's, providing care, in the Northeast. And, when they called, they said, Jordan, can you bring flu vaccine? Can you bring, COVID vaccine? Yes, absolutely. The other, we just had one of our patients picked up by ICE, and he's detained at Batavia. I knew I know I'm on the Rock Resilience table, but I couldn't remember those phone numbers like I could remember, Beatrice LeBron and Irene, Sanchez, and you were next, Angie. And so, in a panic, I know, I'm like, I know we have people that we can call. Urban League, I don't know if you remember the town halls where those were fun actually, where we did these kind of radio broadcasts around education related to COVID. When they started, well, they're always doing advocacy work, but they have our blueprints for anti-racist work in our community. So I feel like I'm always working with these different organizations on so many levels, and it's a give and a take. The relationship doesn't work if you're just taking. So we're truly working back and forth. So those are just some of the specific examples. But we still have vision, and some people have heard me talk about our vision of the community health village. which was started before I got here, thinking about this, because I supported that vision from the Common Ground Health side, with data and things like that. And I'm continuing on this side. But we have a vision of a village where we're all together, where people can get everything they need. And we do one-stop shopping already, right, at our Jordan centers, but this is it on steroids, right? You come in and maybe when you're going to go see the specialist, because we're going to actually get specialists within the city limits here, not just out in the suburbs. And you can see primary care, maybe physical therapy, and all these things. It's not that easy for people to get right now. But then also, what are all the other things that are important for health? Are you going to be able to go get an AA meeting there? Are you going to have a place for some meditation and prayer, some place where your kid can get after school homework done? Will we have an office where, ABC sits and they can connect you to some other resources? How do we form this village? And one of the institutions we had thought about having in partnership is housing. So, do I talk to Dr. Henry about, how can the YWCA work with us? We're not building housing. That's not Jordan, right? So we need to partner with all of you that are doing the things we don't know how to do. And so thank you already for what you've done and anticipation of what we're going to build together.
And brilliant, brilliant. And as I tell people, Jordan is the community's health center. So many of our clients here at Action for a Better Community, Jordan is where they go for care. One of the things I love about our relationship, and specifically with the children, is the dental care that we get from Jordan. You forgot to mention that, but I'm not going
See, I
you
didn't
know,
even get because ABC is too long a list, right?
so our Head Start children, and when the children get dental care, but so the extension is okay. What about the parents? So those are things that we've talked about because and Dr. Harbin, Dr. Clark's predecessor, she's the one that said, people just separate the dental care from the rest of the body. It's the same thing. So we're getting better at integrating all of the services. And I love the idea of what you said, just have a village of care, where we can just go get what we need. Just brilliant, brilliant. Nikisha, power shows up differently, you know, especially when you're leading systems, and you referred to this earlier, that weren't really built with a vision of you in mind as the leader. So how do you decide when you work within that system, or as my friend Dr. Hawkins would say, or if you want to just interrupt or disrupt that system? How you do that? I mean, just let me just put a little bit more editorial on the question, because all of what we do is nuance, but working with people with disabilities, given what you said earlier, is really nuanced. So, I mean, when do you have to bring out that black girl magic? How do you decide if it's a pop off the earrings kind of day, or you just gonna go with the flow?
Yeah, it seems like my whole career I've had to navigate the system that wasn't built with me in mind, beyond that certain level. And the best example I have for this is last year, we had to renew our parent training information grant, which is funded through the Department of Education. The updated guidance, and it's a 5-year cycle grant. The updated guidance for the funding included the exclusionary list of 100 words, such as
Mhm.
disability, inclusion, advocacy, women, Latino, and Black. And for those who don't know, Starbridge was formed in 2015 through the merger of the Advocacy Center and LDA Life and Learning Services, so the Learning Disability Association. And now I had to decide, do I, follow the rules and exclude the very words for which our organization was founded. And my team was saying, well, maybe we hide our mission statement that includes these words. And Jerome, for me, the decision was clear. I'm never going to put myself on the auction block and co-sign the erasure of my identity or existence for a dollar or a title. And I'm not going to ask anyone else to. But I still had to consider the consequences if we don't receive this funding. It's going to impact 13 of my employees. It's going to cause harm to the community. This is a service funding that we had received for over 2 decades of educational advocacy, as well as my core community partners. So I really had to take a step back, have a conversation, a transparent conversation with my team, because we're using the words. I knew we were going to use the words. And I knew that I had to take care of home first. I wouldn't be able to continue to provide the services through our core community partners. We reach 55 counties within New York State. And my executive team and I were working on a contingency plan. So we're working on the grant, as well as creating a contingency plan to ensure that I can keep the 13 employees employed and continue the service to the community and cause no harm. I shared with the team, like, we're not going to hide our mission. This is who we are. This is providing supports to people with disabilities and their families, and transforming the community to include everyone. This is what we do. So my team supported me, and we moved forward. We received the funding, so we were excited. We were excited about that. Again, it's a 5-year cycle, but due to it being through the Department of Education, we're only guaranteed funding for the first year.
Yeah.
So the threat is still prevalent, and we may have to implement that contingency plan, but I could not sell out. As much as we needed those dollars, I could not erase myself as a Black woman and not use those words. I'm not going to ask anyone that receives services from us or anyone working for us with a disability to shrink for funding. So as Dr. Hawkins had said, sometimes we have to say no. And that's where we were. But thankfully, we did receive that funding temporarily.
Yeah. One of the things that Simeon said, our work requires us to confront the difficult things. So, standing firm in times, because what do we have in our side? He also said the power of morality. The power of morality. Sean, I'm coming back to you. For the people listening, whether they're listening now or when we make this available. So funders, policymakers, partners, emerging leaders as well. What is one concrete action that would most meaningfully support BIPOC-led organizations right now? What do you want, action item? What do you want people to do? And what is the cost to our communities if we continue to ask leaders to do more without changing the systems that are frustrating us so much?
Yeah. One, be the interruption. That's number one, be the interruption. So thank you for reminding us of our own language. And that means intentional investment. And so what does intentional investment looks like? True partnerships without you telling me what to do. Don't tell me how to run my organization or serve my community. Because one of the things we do, just like we do at all of our organizations, we have the voice of the community. They let us know what they want. And so it's important for you to trust us as community leading organizations to know what our communities need because we're listening. And so trust us to make the investment in us and trust us to serve the community and not do it with strings attached. And I think that is going to be increased. So it has to be intentional partnership. And so how do we do that? We have to get deeper. We have to have those intentional conversations, understand what our struggles are, what we need, what the community needs, and how they can help us, and what investments we need of them. And so that's one of the things that I would say to our funders.
Okay. Hmm. Yeah, that's just last night. Like last night, Angie, I'm going to it. Last night, Angie and I were having dinner together with a couple other people, talking about the same stuff. And we were talking about, and you weren't even there, but we're on the choir, investing in our organizations, trusting us enough, sufficiently so that know that we have skill and talent and capability, but trusting us enough to write the check without conditions of control or direction. Know that I was just doing a little back of the envelope calculation here on the side. Our organizations, and when I say our organizations, I'm including Dr. Myra Henry of the YWCA, who couldn't be here today. Um, Somebody mentioned my other little sister, uh, Sharita Bullock. Um, our organizations employ collectively over 1,000 people, and we serve near 100,000 people in Monroe County over and over again. In October and going into November last, there was a 43-day government shutdown. That was extremely painful to many of us. But guess what? Here we are. And we're facing on the barrel of another shutdown. I say that to echo what Dr. Hawkins just said. We have some skill and capability to do stuff. As young people say, we know some things. We we actually know some things. And in terms of partnership, not only with ourselves, but with government entities, with philanthropy, with the private sector, who we're also just waiting to jump into this investment, because the private sector, and specifically members of the Chamber of Commerce, what we have is something that we know you want. And it's a community of people who are hardworking. We're trying to keep them as healthy as possible. You know, as our mayor would say, one of the best anti-violence strategies is a good paying job. One of the best anti-violence strategies is a good paying job. So those of us who are in the workforce development space, send us your specs for what you want. We'll get people trained on the soft skills of deportment and whatnot. We'll make sure they go to Jordan to get and then know their numbers. And if, God forbid, there are people with disabilities, Nikisha is right there to advocate for them, so that we are critical in supplying and helping to sort of hold up this community in a way that is extremely valuable. So and just a few months ago, when it got even darker with the government shutdown, and talking to people, I said, can you imagine a Rochester without a bureau? Can you imagine a Rochester without the Urban League? Can you imagine Rochester without ABC, without Jordan? Because it got that close, people. Can you imagine? So our collective work together is really, really serious. And like I said, sometimes it gets dark. But we're not new to this. We're true to this. We're committed to this community. So in just getting ready to sort of land this plane, so to speak, I want to, as a matter of fact, there was in the chat, somebody was bigging up just the black girl magic that's in the room and recognizing you all, so I wanted to just pass that on. There's a question here for Dr. Clark. I like the know in advance who the right few people are. Oh, it's just a comment. It basically says, I like to know in advance who the right few people are. And she's going back to, that discernment that you have to grow into in in jobs like this, because it's a very, 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 very lonely place. So there's a certain amount of discernment that we need. And Nikisha, I'll come back to you with one last question, and then I'll ask you for closing comments as we get ready to land this version of the plane. Solidarity, that word solidarity that we do use in the theme of this conference, strength and solidarity, actually. Um, we can get comfortable with that word, right? In your experience, what does real solidarity between BIPOC leaders demand, especially when, as we've been saying, resources are tight and expectations are high? What does solidarity mean for you?
Oh, it means kindness, respect, trust, and a welcoming attitude. And I have two quick examples of that. When I stepped into the CEO role and I began to realize that I needed to build relationships and expand my network, I reached out to many leaders and BIPOC leaders, and only a handful accepted the call. And Angie invited me over to Ibero, and I met with her. And as I began sharing with her some of my experience and needing to, especially needing to divest from our supportive apartment program, and how I had struggled with going through that process, I saw her just sigh, and she said, Nikisha, I wish I would have known. I could have helped you. I could have helped you through that process. But being a new CEO, I didn't even know who to ask. I didn't know beyond the OPWDD teams. I didn't know in the community who I could help. And then again, as what Dr. Clark said, who I can trust, who is going to hold my conversation in confidence and help me navigate that. And I could really see the genuine, the authenticity that Angie had, and just saying like, oh, I wish you would have reached out. I wish I would have known, because I could have helped you. I could have helped you navigate that because I had been through it. And in knowing that, probably about a year after that, I found myself, because it ebbs and flows. Like I found myself overwhelmed, feeling like I was drowning, couldn't get my feet under me. So I decided to have that courageous or the courage and that vulnerability. I used my phone a friend, and I called Dr. Hawkins, and I was like, she and I were serving on this board, and we had split the responsibilities. And I was doing the work, and I was doing my work at Starbridge, but it didn't seem like I was doing anything well. And I called her and I said, I feel like I drew the short straw. I'm not doing any of this well. And she said, I got you. I got you. Let me take this and let me be the lead, because I know what you're experiencing. I know what you're going through, because I've been there. So I'm going to take this from you. And Nikisha, don't say yes to another thing unless it's
Mm.
Starbridge, unless it's something directly to improve Starbridge. You just focus on Starbridge. Let me handle this, and you take care of Starbridge, but don't say yes to another thing. And I share that because I was so grateful. Had Angie not planted that seed of, girl, why didn't you reach out to somebody? Don't sit over there struggling. You better, reach out. It gave me that courage to like, let me, and they don't know, they didn't know me well, and they still don't know me that well, but to know that they were like, "Hey, sis, I'm not gonna let you slip. Um, Call me, and I'll do what I can to help you." And then now I obviously pay that forward as well. So I'm so appreciative. But that is absolutely what is needed in our BIPOC communities as we continue to lead and navigate in these spaces that we haven't been in long, and we don't have the breadth of looking to see um, others who have been in these roles for 10 and 12 and 13 years that look like us. So that's what I would say. I appreciated their kindness, their trust, their welcoming me in, and helping keeping me covered. So thank you, thank you, thank you.
And thank you. Dr. Clark, um, some closing words for our for your fellow panelists and our attendees.
You know, I didn't prepare anything because I thought I was going to have snuck out by now.
Right, right. If you stay, I know you got some.
You know, I don't know. Thank God for you. Thank God for all of the, I don't know where he went, for all of you on this panel and, the people that supported me and my journey, through Jordan. But it's not just my journey through Jordan, it's my journey through this community and, the various roles and I am just thankful for the trust that I've experienced from all of you. And I think that's a key component to being a community that loves one another is the trust factor. And, everybody doesn't deserve your trust, and you should not give it out freely. So when I think about partnerships, when I think about solidarity, it's not just looking at my budget, right? It's looking at who's going to join me and with my heart and my mind and the soul that I have for our community. And I think I can't remember if it was Dr. Hawkins or Nikisha who said, you don't just take the money for the money, because sometimes money can divide your organization. It can create all sorts of inequities within not just the community, but your organization itself. I've dealt with that. And truly understanding that what's going to get things done in this community is the relationship. It's the relationship. And I think that's when I first came to Rochester and we bought our house, and I told my husband, just paint all the walls white. I ain't gonna be here, but for a few a few years, we're gonna sell the house, and I'm gonna get out of here. Well, let's see. Our baby was 1. He's 30 now. So obviously, I'm here for a minute. And one of the things I just loved about this community is it's big enough to do some bold things, but small enough that you could really have the relationships to do that. I think it's very unique. I can never go home to the Washington, D.C. area and do something like this. So anyways, thank you so much for the invitation today. And it's given me new inspiration, just new thoughts and ideas of how we can continue the relationships that we're building. And that definitely it's a verb. We're continuing to do it. So thank you so much.
You're welcome. Angie, final words from you.
Yeah, I mean, I think thank you all of you guys for sharing. I always feel so blessed to be among such great leaders. I know we don't always spend time together in the way that we want to, but I do find comfort whenever we come together. So to me, that has just been instrumental. One of the things that I love about the BIPOC leadership community in Rochester is that we do have a shared vision. We do feel very, very passionately about where we want to see our community move forward. And when the rubber meets the road, we come together in ways that I don't think other people in our community realize, to make sure that there is always alignment among us, that we're opening up the spaces and that part. When you go out to other states and interact with other nonprofits, I know that that's non-existent in some places. So I never take it for granted. I think for me is, at the end of the day, We are dealers of hope in our community. We have been given opportunities that people will live multiple lifetimes and will never have. We have been charged with changing lives and shaping our community. And that to me is such an overwhelming, undeserving privilege because it's so much bigger than what I ever envisioned I would do in my life. So for me, I always lead with that first. And that means that I'm always going to bring my heart into it, no matter how uncomfortable that makes people feel around me. I'm always going to lead with my heart first. The leadership that comes from my heart doesn't devalue our operational skills and
Yes.
rigor. I have a
Yes.
hell of a strategic plan. I am a hell of a turnaround. I turned the heck around out of Ibero. We went from a $1.4 million deficit, from thinking we were going to close our door, to a surplus, to good operational strength
Come
so that
on.
we can be present for our community. And I
Yeah.
will not let anyone take that away from Ibero and my team and my staff, because we can lead with heart, we can have operational rigor, and we can I'm struggling to find the word, um and we can do it together. There is, I hear people talk about competition, and I always wonder who they're talking about. Like in my
Right.
mind, I go, who are they talking about? Are they talking about me? Or, are they talking about Ibero? Because I never see myself in competition with Dr. Hawkins. I never see myself in competition with Jerome. I never see I feel like we all have this little corner that we've kind of said, give me the ball, coach, and I'm gonna run it.
Yeah.
And I want that myth to be broken. We are
Yeah.
not in competition
Say
with
it.
each other. We are truly a group of leaders that had come together because we either were brought up by this community and we passionately feel that we want to change our community. So I really just want to dismiss that. And that was proof when
Dismiss.
we've lost funding and we've all come to the table together to advocate for each other.
Yes.
So I also just want to dismiss that because we don't compete with each other. And for any new leader out there, don't ever think that I want to work myself out of a job. I really do. I want Ibero to one day not exist. And for anybody who speaks Spanish to be able to walk into all institutions the same way that they do in Jordan, the same way that they do in Jerome, the same way that they do with Nikisha, the same way that they do with Dr. Hawkins, because I see them promoting people that look and speak my language. I see them opening the door for our community. I want everybody else to do that so that an agency like mine no longer has to exist. So I think that's just lead with heart, lead with operational rigor, lead with courage, and bring everybody that you can with you that's going to help your community feel progress.
Bring everybody. Well said, Angie. Sean, your thoughts.
Yeah, first of all, this was an incredible panel, and I'm grateful to be sharing this space with these incredible and tremendous leaders. And when I think about solidarity, it looks like just what we all said: shared risk, shared learning, shared advocacy, where we're honest about capacity. Thank you for sharing that, Nikisha. When we're transparent about our challenges, and we're willing to move together, we operate together. But it also looks like community support. I don't want to miss that opportunity because we've got folks on this call right now, and we can't do this work without them because we've talked about being under resourced, underfunded, right? And the work that we've had to do to navigate the challenging times. So it's important for community members to give, right? To give their treasure. And I know this is I'm if folks know me, I'm always gonna close with getting a dollar because we need that. We need that. Because if you're sitting here watching and you're not supporting one of our organizations, then I challenge you to get in solidarity with us. I challenge you to give. So if you can't give money, when we're not at the table and things are happening, you lift our names, you lift our voice, you lift your voice for the organizations to make sure that we're in the room where the decisions are being made. And most times we are, but there are those times where we're not. So use your voice for advocacy. So solidarity can look like advocacy. It could look like giving your treasure to one of us or all of us. It's Dr. Martin Luther King's Day. Maybe it's all of us today. But
Yes.
also, it looks like that advocacy. And so it's important that we do that work. So thank you for bringing us together, Mr. Jerome Underwood, for having this conversation because we need to talk about the work that we're doing, but still the lack of investment that has to happen.
Yes,
So thank
indeed.
you.
And before I yield for Nikisha to give her final words, please, folks, because we're data driven, so fill out the survey for us and tell us what you like, what was average or what was horrible, and give us your thoughts. We really, really use that to try to help with what we designed for you. Nikisha, your final comments before we take our break for lunch.
Well, I agree with everything that has been said. And I really would just encourage people to know and have that mindset of love and that there's enough space, there's more than enough room for all of us, and to not have the mindset that there's scarcity. So that's where I would think I would leave it. Just create the space and use your phone of friends and be willing to pick up and be willing to assist and help, as Dr. Hawkins and Angie and Dr. Clark have said. And I absolutely want to thank you, Jerome, for always supporting me when I need to phone a friend or when I'm running up to you, when I see you in public. I so appreciate your leadership. Thank you so much.
Jerome is the village convener, if people don't know him.
Yes, yes, he is. Thank you, big brother.
One day last time we were having lunch, I looked around like, wait a minute, I'm the elder here. When did
Yeah,
that
you
happen?
are. You're older
Because,
than I am. I just like to remind you.
all right, okay, all right. So, and where did Sean go? Oh, she dropped out. But Sean
Oh.
and I talked. ABC and the Urban League. We're almost like twins. We were born just about the same time, but I remind my sister Sean, we were born a couple minutes before her. So, but we both had our 60th anniversary last year, and we're partners in good. That's
Yeah.
what we are. We're partners with all of us, and we care deeply about this community. And as you said, we're dedicated. We're dedicated to helping people help themselves and each other.